I am Alan LaFontaine, Executive Director of the Aurelia District Chamber of Commerce. I'm joined today by Doug Alexander, Vice President, Technical Services for the Belmont Food Group, and Scott Ashley, President and CEO of Get Ready Global. Welcome.
Thank you.
Hello, thank you. Hi, Alan. How are you? Hi, Erica.
Very good. We're here today to talk about rapid antigen free test program that the Ontario Chamber Network has rolled out. Of course, Aurelia District Chamber of Commerce is working with Muskoka Lakes, Gravenhurst, Bracebridge, Huntsville / Lake of Bays Chambers of Commerce. And we're trying to get these rapid tests out and into our community. We're working with Get Ready Global for workplace screening and to help with our customer pickup and signing agreements for the rapid antigen tests. Province of Ontario announced stay-at-home order has been extended to June 2nd, 2021. It's clear we must all take steps to reopen our businesses safely. It's also clear that we want life to return to normal. Right. With the free rapid antigen test program, we're hoping businesses will take a 4-step approach in getting this thing done. Step 1 is to follow our health officials' rules, which are washing your hands, social distancing, shortening our social network, and wearing masks. While this continues to be a challenge, most people are participating. The step 2 is the province of Ontario is rolling out vaccines quicker. Ontario announced that over 50% of residents have received their first shot. We want to avoid that 4th and 5th wave. Doug, what are you doing at Belmont Foods to recommend and promote vaccinations within your employees?
So we started our campaign of training people on what this pandemic is about 1.5 years ago, once it was introduced, and really educating people as to what the disease is and what the risks are was the beginning of, first of all, ICP, and part of infection control protocol is obviously vaccination. So building people's confidence that this is something that's manageable, but not preventable. And the only real way to prevent it is vaccination. De-risking people's fears around a lot of the misinformation out there. So we did a lot of sharing of scientific data on the risks associated with blood clots and the AstraZeneca, and the risks associated with the other two vaccines, mRNA vaccines, and encouraged people to just overcome their fears and really trust the history of 150 years of vaccinations and how it works.
That sounds smart, and I've had the AstraZeneca. It seems to have been working. Of course, Prime Minister and Premier of Ontario have also had that, and I do believe that the first vaccine available is the best and part of that. Step 3 we really see is workplace screening. 2 weeks ago, the Ministry of Labor, Simcoe Muskoka Health Unit were on a blitz to ensure workplaces had proper workplace screening in place. We're all learning as we go, and I don't think as many people had it. And while there's a free tool from the province of Ontario, Scott Ashley, President and CDO of Get Ready Global, has put out an app to make this easier. I know we use it here. Scott, what's the real advantages of what you created for an employer?
Well, there's a bunch of things, and I think first of all, we've all seen and heard stories that when someone has the virus and they get exposed to others, now we have a risk of transmission, we have a risk of an outbreak, and public health needs to engage to start contact tracing to notify the people that might have been exposed to prevent that outbreak. So a workplace, organization has to track the people that arrive at the business every day. They have to find out, not only, the usual questions that everybody knows, do you have the signs and symptoms, and have you been out of the country and exposed to people, but you have to have a record of those people. And so, the problem occurs when, let's say next week from now, someone in the office phones in sick or say, I've just tested positive. Well, who else was exposed to them the day before, last week, and so on? And organizations need to be able to go back to the database quickly and easily and see how many staff, customers, visitors, essential visitors, contractors may have been on site and exposed, so they can quickly and easily get that information to public health. Otherwise, they have to take hours and hours and hours and go back and try to figure out who was here when, what their contact information is. And it usually takes 3 to 5 days before public health is given that information. Well, in 3 to 5 days, that suddenly what could have been a smaller, minor outbreak is now turned into a much larger outbreak. So not only does that frighten people and makes them anxious about coming to work, but it also impacts the business's ability to operate and serve their customers and the reputational issues. So, to take a minute or two and do proper screening and keep a record of this. What we've done is built it so that people can do it off their phones, off their computers. It tracks it, it's easy, it makes the manager's life way easier, and nobody, let's face it, we've all gone into places where they have, a clipboard, they have pens, they have paper. Nobody wants to touch the pens. Nobody, the managers don't want to touch all the paper at the end of the day or have to go through, a week's work of paper. So that's important, having a touchless system, being able to go and backtrack. The ministry has a free tracking tool, but it only records that you went somewhere and they have it. A company can't get the list of all the people that use that app. And so at the end of the day, yes, we found out, the government, has a record, but no one else does. And the company can't sort it out. So they have to have proper screening. And I think, we spent a lot of time. We have literally hundreds of companies using it now, and it's easy, it's simple, it's very inexpensive and quick to onboard. So it's a great process.
Well, Doug, I understand that Belmont Food Group has get ready with the app. Just share with us, what does it mean to your company? You're a larger employer. How has this changed the game for you?
So active screening, as Scott mentioned, is required, and there's a number of ways to do it. Obviously, a paper tracing, and that's cumbersome. So at all 6 of our plants, including the 2 in Aurelia, we implemented Get Ready out early February to really take the manual process of active screening out. And there's passive screening where you wait till the person comes, and then you ask them the question and you check their temperature, and it's probably a little bit too late. And the advantage to using an app and active screening that's somewhat automated is, one, you're notified if somebody isn't eligible to come to work and they've said that they've answered yes to any one of the questions that they're not eligible. And two, it makes a person think before they come to work about all those critical questions. And when they arrive, should they change their mind, they've had a chance to think about it and say, you know what, that headache doesn't really feel like a headache. And so the advantage of really augmenting our process of when in doubt, out seems to work. And it really made it a little bit better and a little bit more reliable. And it's incredibly cost effective. We can track around 600 employees over multiple locations, and it's incredibly cost effective. It was really easy to set up, and all the users have become very good at using it. So most of our employees sign on their phone. They log in. The QR code's right in our email. So if we have a visitor coming, they can just wave their phone over top of it and answer the questions rather than line people up at the door and checking them. It's incredibly efficient, cost effective, and automated on the data collection. So if we have an issue where we have to show to public health or some other authority who was in where and when, we've got real quick access to demonstrate from the dashboard the data of the health conditions and awareness of our employees.
We use it here, and we don't have as many employees that you do, Doug. However, who has more time these days? It's just not becoming available. So from our perspective, I think I've even seen staff are feeling a little better that somebody comes into our office, that they're screened. And that has to be a big part of employee confidence and consumer confidence. Wouldn't you agree?
Yep.
Yeah.
So we're going to go to rapid antigen testing. We're going to still talk, Scott, has been so grateful to help us. We're going to be handing out, I got 100,000 rapid antigen tests sitting in my office, ready to go. We're building the program. We're launching Monday. I'm shaking in my boots because we've got to get the systems right. But the great folks that get ready have helped us with our check-in for those people that are going to come pick up the rapid antigen tests. We were also very fortunate that we've been working with the Muskoka Lakes, Gravenhurst, Bracebridge, Huntsville / Lake of Bays chambers of commerce to put this plan together. So we've had a lot of heads come together, countless meetings trying to organize this through. It seems like this is the missing link in the vaccination, social distancing, and the workplace screening. It really kind of goes all together. And I think this is the full court press for us to get back to normal. Doug, what is rapid testing? You've implemented it within your company. You've got a little head start on this. What does it mean for your business and your employees, especially coming in and knowing that everybody's being tested? Or how did you implement it?
So I've always got some nearby. Typically, there's 25 right in front of me. I think I've got about 250 in my office here, and usually in around 4,000 or 5,000 centralized so we can distribute it. The first concern that came up when we entered into the OMAFRA program around it, and what the chamber is doing is outstanding, getting it out into more outside of the food industry into more common use, was what do you do when somebody's positive? And it's almost laughable now looking back on it. And even 15 minutes ago, before we did this call, we were talking about identifying employees that were community spread positives and how do you catch them and keep them from coming to work and spreading it at work. It's like feeling around in the dark with this disease. It has pre-symptomatic and asymptomatic spread. Most people have no idea they have it, even if they have mild symptoms. It is highly contagious in air. There is nothing worse to try and control that without testing. It is astounding that as a society or a planet, we didn't start this last summer. It would have been a night and day game changer had we started when Taiwan and a number of other, South Korea, started testing rapidly. Now Germany, the United Kingdom are doing it nationally. Canada's really starting to roll this out. And the biggest resistance to this is, what do you do when somebody's positive? That's really good if you know when somebody's positive, because you really can't know any other way. You're just guessing and feeling around in the dark. So it has really helped us in many of our sites identify prior to spread positives and keep them out of the workplace. Most spread is actually in community spread, in congregate living, where people live either multi-generations to a home or in apartment buildings, and it spreads rapidly there. Then it comes to the workplace, and if you're wearing PPE, it doesn't spread as easily. However, people make mistakes, things don't go perfectly, so it helps contain that by doing that rapid antigen testing screening to augment everything else and all the other layers we do. For us, it's probably prevented somewhere in the nature of 20 to 25 positives from creating outbreaks in our workplaces. And I can speak to that because we're catching positives in our facilities and it's not creating a spread. We hold our breath and we test a lot, but it's not been disruptive to our plants. We've not had to shut down as a result of doing rapid antigen testing. And it's all really built around the premise that we wear PPE to prevent the spread. And as long as people are following good protocols right across the board, then it shouldn't spread at work. You just identify the community spread and prevent it from coming into your work and having incidental spread. It's a critical tool for us.
So Scott, you've obviously jumped on this industry with workplace screening. What are your thoughts about integrating workplace screening with rapid testing? Is it a game changer?
Oh, I think this is probably the biggest thing, besides the vaccine. And everyone's talking about the vaccine, and they should be. And it's exciting, and it's great to hear that it's coming, and it started, and it will continue to roll out. But it's also going to be, the opinion is late August, September before most people have had their second jab or their second shot. And that's great. And we can all look forward to the fall, but people want to get to work now. And what we need to do is create that confident scenario. If we don't have confidence, if employees or customers, vendors, whatever, don't have that confidence, they don't want to come to your site. So you need to screen, because that's the law. We need to know who is here, who's sick, who's not, who's coming in, and so on. But the asymptomatic shedder, the asymptomatic person is basically by definition someone who does not have any signs or symptoms. They feel fine, and yet they are still shedding virus. So they pass the screening, they come into work, and that's where we can cause now transmission to occur and an outbreak. With this new rapid antigen testing, in 15 minutes, we know the results, and we can say to someone, hey, you know what, you are positive and you can't come to work. Therefore, preventing the outbreak happening at work. Secondly, getting them the help they need instead of waiting another 3, 4, 5, 6, 7 days before they're actually symptomatic and they're quite sick. So we can get them into getting a PCR test done, getting them into the medical system quickly, preventing that larger outbreak. I actually think it's the biggest game changer, until we actually hit, the vaccine levels that we need to be. And that's going to be another few months. Well, let's get the economy going. Let's get people back to work. Let's demonstrate the confidence. And, as much as I say to people all the time, this is a global medical disaster. It's also a psychological thriller. And if we can keep people confident and willing to come in because they see that the steps are being done right, and they see that there's, they're tracking and they're following and they're looking in to see who's sick and who's not, that's a game changer entirely. So I think it's a big deal.
You mentioned a point on consumer confidence. We did a study last year just when it came to wearing masks and proper PPE. By displaying in your workplace that you have all of those 4 steps taken care of is going to be something that's going to allow people to go back in. Would you go to a restaurant that all of their staff is doing the testing, the workplace screening, have all the proper PPE? And it did show from a consumer standpoint that there are a lot of us staying home. While we see all the protests, we see people out, for those people, there's probably 90% are doing what it takes. So it's going to be up to businesses to put these processes in place and really demonstrate that, advertise that fact that we're doing everything to keep you safe. You become the wise choice to go into. So that's why the chamber feels it's very important to get these rapid tests out, in fact, and why we're promoting for business. If you want to save some time and money and energy, get a workplace screening. That's got to be a consumer confidence to know that a company's taking all these steps. In fact, there was a local business last year, put a squirt of hand sanitizer in your hand when you walked into their patio, ask for your name, your number. Everybody was wearing masks. They had a line up out the door. We ended up taking that to Port of Aurelia. To implement in our system because we wanted to make our customers safe.
Right.
Now we're going to move on a little bit just to this Get Ready app. Scott, you've been tremendous helping us get ready to hand out these rapid antigen tests. Could you maybe just go through that process of a company's going to go on a website to order, but they're going to screen in using Get Ready app. Could you quickly
There's
explain that
sort of 2
process?
parts to it. One is so they can go to the chamber and they can say, we'd like to order the rapid antigen test kits. But before they do that, they need to be trained. So whoever the person is going to be running the screening process, could be the owner, could be a manager, health and safety person, could be a number of people in the company. They take the training, they do it online. There's a quiz, they complete that, they submit it, and the chamber can see the results. So they know that that person coming has completed and passed the required training. Secondly, they do the screening, they use the daily screening tool so that they can be assessed to make sure that they are in fact healthy. So when they come to your location for their curbside pickup of the kits, you know that those people have A, screened, and B, they've completed the required training. So now that organization is going to be much more prepared, and we've, prepared with that all kinds of creatives for stickers that they can put on their doors to say that they are part of a daily screening and an antigen testing program. There's stuff for their website. There's information letters going out. A lot of people, and part of this is around definitions and the use of words, but, people will talk about a daily screening tool. They'll also talk about an antigen screening test, and they don't know what the difference between the two is. One is the questions and tracking who's coming on site and are they healthy and fit to come to work. And the other one is the antigen test, where people actually self-test. They take the little swab, they put it up in their nose, they put it into a test tube. There's a certain amount of fluid added to that. They put some drips on a card, and in 15 minutes, they can see whether they're positive or negative. They don't need medical people to do this. You don't have to hire out nurses and paramedics and pay those wages. All your staff can do this themselves. And the training is really for your supervisor or the plant manager or health and safety person to help oversee and guide the staff through it. And that's exactly what Doug's holding, that little card. That's the magic card. You either get one line or two, you're either positive or negative, and you know the results in 15 minutes. And if you were the individual who was actually sick, you would want to know as soon as possible that was the case, so you could start to get medical care and protect obviously your friends and family and coworkers, right? So I think it's easy, it's quick, but we've really tried to take all the guesswork out of it. Companies don't have a lot of time. They're not going to send people to a course. They can do it all online. We've given them the support documents and signage and emails and communications that go out to staff and clients and so on, so that it's a quick and rapid rollout of the program. So I'm hoping that on Monday, you're going to get a lot of uptake, but it's also going to be pretty easy.
So you've got a code then, when people want to connect, they can come through our chamber, Muskoka, Lakes, Gravenhurst, Bracebridge, Huntsville, Lake Bays. You're going to be able to get them a code. They'll get an initial discount to get into the program. Is that right?
Correct. Yeah. Every chamber, every distribution partner has a URL code. They can send it out to their members. They simply click on it. The daily screening app is $19.95 a month, and that's for unlimited users, staff, visitors, customers, contractors coming on site, whatever. They can send them the QR code. Staff fill it out every day. Customers when they arrive. Everyone using it. And then you have a record. So it's easy. All the chambers have a unique one. They can send it out to their own members. They can give them a discount or a coupon so they can save a little bit of money for non-members or members. And part of the chambers program then is the training around the antigen testing as well.
Perfect. I know
there's no cost for that.
I know your company's got a lot of things you're working on right now. You were sharing with me the other day that you're actually looking at the shot pattern from singers. We hope music gets back to all of us soon. Just share that quickly. I mean, your company does more than just the work. Screening.
Yeah, this is actually really exciting. The science and technology around the pandemic and the things that have come out of it. We're working with a Toronto-based company called Poppy. And Poppy is a group of scientists, and what they can do is they can monitor pathogens in the air, and they can actually tell you if there's COVID in the air. They actually monitor up to 3,000 different pathogens. But right now we're doing some work with the Four Seasons and the Canadian Opera Company to look at how pathogens travel in the air inside a theater. And we're getting interest from all over the place, from within Ontario here, different community groups, theater groups, the concerts, the summer concert series. What do we need to do for performers, for backstage, for the patrons, for the the guests coming to the concerts and shows? How do we keep everybody safe? And so this research that's being done right now, this study, down at the Canadian Opera Company is groundbreaking. They're working with the University of Nebraska, and they've got people from the NASA teams that have been looking at keeping pathogens from getting up into the International Space Station and returning back to Earth. And it's pretty interesting stuff. So that report should be out in a couple of weeks, and we're going to be, I know there's a lot of groups, you know, theater groups and stuff, all looking to see, wow, how does that really impact us? And, you know, so it's good. Very interesting stuff.
Well, thank you for that. We need music to lift ourselves.
For sure.
Doug Alexander, Vice President of Technical Services, Belmont Food Group. Thank you for joining us. Any final parting words for us?
Well, from our experience working with Get Ready, they are by far the best partners on infection control protocol. We were pleasantly surprised with the value of the Get Ready app, the knowledge, the training that comes with it. They don't align themselves with folks that don't know what they're doing. And if you don't, they teach you. So we were really happy. It's been the best decision we've made. And I really have to encourage everyone to do active screening, wear PPE, do the rapid antigen testing, and then our society can get back to normal. Those that are complaining about the restrictions on society, let's follow all the infection control protocol we possibly can, and we can get back to normal faster.
Yeah.
Great advice. And Scott Ashley, President and CEO of Get Ready Global. Thank you for your time in this. And what are your final parting words on this?
Well, you know, it's like spokes in a wheel. The more spokes you have, the stronger the wheel. So you still need your physical distancing. You still need to be wearing masks and using hand sanitizer. And that's basic infection prevention control guidelines. On top of that, if we can do the screening, if we can do the rapid testing, if we can get the vaccine to continue to roll out, and we can make people and help them to be patient. You know, sometimes you're at the grocery store and you want to get going. Just be patient. Take a little bit longer, and you know, some of those useful things. This is totally doable. This is, you know, hospitals have been doing this for 100 years, and now every workplace has to do it as well. And I know, you know, Doug and his team, they've done a fabulous job. They've made a big difference down there, and I think it's obvious to everyone the confidence of their employees, the fact that they haven't had the outbreaks, they're able to continue to employ people and provide products, you know, to the consumers that everyone loves. So I think it's you know, it's achievable for sure. And you know, the next few months will be interesting as the vaccines continue to roll out. But in the meantime, let's screen, let's wear our mask, let's do the rapid testing, let's be safe, and let's get back to work and you know, enjoy the summer.
Well, I think that we have to follow up with these 4 pillars. It's, you know, it's bottom of the 9th here. Let's get this done. We want to get back to normal.
Let's get back to normal.
Yeah. So thank you for everyone for joining us today. And really a district chamber of commerce. So really in Lake Country, Muskoka Lakes, Gravenhurst, Bracebridge, Huntsville, and Lake Bays. Get ready to reopen your business safely. Promote vaccines with employees. Get rapid testing. Please get a hold of Get Ready and get an app that's going to save you time and make workplace screening is going to help your employees have confidence to come into work every day. It's going to help with your customers to come in every day, and connect with your chamber to order these rapid tests, that final step in that process, so that we can all get back to normal. And we wish you all the best. Do connect with your chamber, get your employees tested.
Great. Well, thank you, Alan, and thanks, Erica. Doug, great to see you again.
Thank you. Always great.
All right.
Well,
take care,
I'm
everyone.
sure we're going to get together for a few more conversations as we go through this. I think they're important conversations.
I can't wait till the patio's open. Let's just
No
call
kidding.
it that.
But we're going to do the next one from the patio if we're allowed to.
Perfect. All right, guys,
That'll
have
be
a great
great.
weekend. It's beautiful weather.
Yeah, enjoy.
All the best.
Take
Thanks
care.
again. Take care. Bye now.